HealthLink is going to be the biggest change that's happened to Valley Medical Center in the last 30, 40 years, and it's going to change our lives in our workplace dramatically.
We are excited here at Santa Clara Valley Health and Hospital System because we are transforming care, and it begins with HealthLink, our electronic health record system.
Well, everybody has heard how all these medical providers have to get electronic medical records as part of the federal requirement for healthcare reform. But for us, the electronic medical record and the personal health record that goes with it is so important, not only to improve patient safety and quality and efficiencies, but more importantly, to improve the health of the community.
Well, currently we have doctors working in the outpatient setting and doctors working in the inpatient setting. And there's not a lot of communication, even though the same doctors going back and forth during the day, but the two settings are quite separate.
We spend so much time tracking down the medical records that takes away from our direct time with the patients that we could be spending working towards their rehab.
HealthLink will improve patient care by improving the access to all of the patient's medical record. It's really going to help us with patient safety and access to that vital information we need to take care of our patients.
It'll really make a dramatic difference for the patients. I think one of the biggest problems we've had at Valley Medical Center over the last 20, 30 years is it's very difficult for patients to contact us.
It'll improve the patient's satisfaction with the billing and registration processes by reducing errors for insurance, demographic, financial information, and it'll also eliminate the need to ask information multiple times of our patients. That's a huge point of frustration right now with our current process.
With the My Health Online, they'll be able to look up their schedules, look at their medications, look at their labs, things that they have to call us now to get a hold of, and as well as they'll be able to communicate with the doctors directly.
Because ultimately that's our goal, that is going to be able to have their own personal record that they can take with themselves anywhere they want.
So I've actually used this particular electronic health record at 3 different institutions. It was great being able to use it, being able to have information readily accessible in a very quick fashion. It was a great experience.
Implementing HealthLink won't be easy, but it will definitely be worth it.
I would say first, be patient, realize that this is a huge change, but ultimately it will be one that will pay off in the end. I think too, it's important to go to the required training, listen, ask plenty of questions, and really don't be afraid to ask questions even after go live.
This is good because I think improves the health of the population. That's really the value proposition, that we're going to provide safer care, that we're going to provide higher quality care, and that we're going to do it at a lower cost. And this is going to help us to continue to thrive in the future as we face with healthcare reform.